So I'm going to talk with you today about the evolution of the learning health system. So in summary, the learning health system used to be publications and slow manual dissemination. In the 70s, this learning health system was not exactly what we would hope it could be. Patient care was based on incomplete paper records, and the knowledge applied to patient care was in the head of the clinician. But the real influential report from the Institute of Medicine came out in 1999. It's called To Err is Human. This report got a lot of publicity in the lay media and really created awareness, general awareness in the public, I believe, of the problem of medical errors. The new learning health system vision is that every patient benefits from and contributes to an accessible experience base. And this vision requires a health information infrastructure. It requires other things too, but it requires a health information infrastructure, and that can be done with health record banks, the Health and Prevention Promotion Initiative, and the Personal Health Grid to solve the 5 key health information infrastructure challenges. And so the anticipated results are a real learning health system and successful pursuit of the triple aim. The goal, the learning health system that we want to achieve, will have electronic patient records and a searchable patient record repository. And that searchable patient record repository will feed into a repository of knowledge and tools through these various methods. And also we will have outcomes data that feeds into our knowledge and tools, and research feeding into our knowledge and tools. And then the way we apply that knowledge to patient care is through decision support that's informed by those individual electronic records and is available at the point of care. The goals of health information infrastructure are, as I said, comprehensive electronic patient records when and where needed, both individual and in the aggregate for research and population health. So how do you get that? What do you need? First, all the information has to be electronic, so all providers must use EHRs. But you also have to have a mechanism to bring together the scattered information for each person, a health information exchange. So first, our current health information infrastructure efforts cannot work. We're on the wrong path. And the reason we're on the wrong path is we're trying to replicate the manual process of contacting other providers directly for records. The solution to this, I would argue, is what's called a health record bank, a secure community-based repository of complete health records where access to the records is completely controlled by the patients or whoever they designate. The architecture of a health record bank is very, very simple. The clinician inquires for the patient record is provided, the encounter occurs, and after the encounter is finished, the new records are deposited and are immediately available for use. And so the challenge is, how can you do efficient searching if you don't have a central database? So here's an architecture that does that. You store each patient's data in a central location, but you have a separate database for each patient, and each patient's record is separately encrypted. So there's no single point of access to all the data. I call this architecture the Personal Health Grid, and filed a patent application in January. So now let me turn for a moment to prevention and population health. So this is now a new activity that is highly incentivized under the Affordable Care Act. Providers don't do it. It's inefficient for each provider to do it. And there are also benefit externalities. One potential solution to this is a collaborative community prevention organization where all providers pool resources and the community organization does prevention and population health for everyone. So I wrote another paper last year proposing how you can link this to health record banks through something I call a Health and Prevention Promotion Initiative, or HAPI. So in this HAPI, you combine a community prevention organization with a health record bank. and the Health Record Bank provides the information you need to do population health, ensures all electronic records. It generates revenue. In fact, it provides funds for itself and more, and in this case, the more is population health. So I would argue that the Health Record Bank approach plus the HAPI population health approach plus the personal health grid is an effective solution for health information infrastructure. And so I think we can anticipate rapid progress in health record bank development.